Hi, I'm Dr. Jessica Broodrÿk, and today I'm here to share with you a little bit about the work that I do to help people with blindness and low vision. So I am an optometrist who specializes in low vision. A little bit about my background: I graduated from the University of Missouri St. Louis College of Optometry in May of 2020, which was a really interesting time to graduate and sort of enter the workforce. From there, I did a low vision and ocular disease residency at the UC Berkeley School of Optometry in California. There I really got a lot of experience working with patients with low vision, and it really just fueled that passion and desire to keep serving this community. So now that I'm finished with residency, I serve patients with low vision at 2 different locations. The first of these locations is the Lighthouse for the Blind in St. Louis. Here I have the opportunity to be a part of 2 of their programs, which is really fun and exciting. The first program is the Children's Low Vision Project. With this project, we actually travel and we get to serve almost the entire state of Missouri. So we try to go out to the underserved, more rural areas and make sure that our students with visual impairment there are getting the services that they need. We serve ages 2 to 22, so we see a wide range of different conditions and visual needs. And I work with teachers of students with visual impairment in this role. So those teachers do a lot of the follow-up care and make sure that the students get all of their devices and everything like that. As far as my role goes, I pretty much do 3 different things. The first thing I do is the low vision examination. Here I'm looking at the students' visual acuity, their contrast sensitivity, their visual field. I do a reading assessment, and I also check color vision on most of my patients. From there, depending on their level of vision, I'll recommend different devices. So sometimes we're looking at monocular telescopes for distance viewing. We also look at magnification for up close, and we evaluate a lot of different electronic options, which is sort of the direction that a lot of education is going right now. So that's really the fun and exciting part. I also get to work for the employees at the Lighthouse for the Blind. So the Lighthouse employs a lot of people with blindness or visual impairment to work in their facilities, and they manufacture all kinds of devices from adhesives and aerosols to medical devices. So it's really a cool thing to be a part of, and the employees are really great to work with. For the employees, I'm doing similar things as I'm doing for the students. So I will evaluate their vision, get an idea of how they're functioning, and then we sit down and talk about it. I always go through the results of the examination and we look at devices. The teachers of students with visual impairment, or TVIs as you might hear them be called, they will actually go with the employee to their workstation and find ways to make it more accessible. They'll trial the devices in their work environment, which is really a special thing that they're able to do. The other location I work at is St. Louis Society for the Blind and Visually Impaired. Here I get to work with occupational therapists, which is a really great opportunity. So I'll do my low vision evaluation, we'll look at some devices, and then the occupational therapists will train the patients on the devices. They also do training on preferential looking and cooking adaptations, all kinds of different lifestyle adaptations, which is really cool to see them work and to have that partnership. So in both of my roles, I'm doing similar things. There's 3 main things that I do as a low vision optometrist. The first thing is to assess a patient's functional vision and give them some concrete numbers. Often they'll just be told things like their vision is count fingers or hand motion. So I really like to have different tests where I can give them a specific number to track over time, even if that number is really high, like 20 over 5,000. I always sit down and talk with my patients about the numbers that we get and make sure that I'm educating them on what this means and the functional impact it will have for their vision. The second thing that I do is recommend devices. So in the low vision exam, we're very goal-oriented. So patients will come in saying that they want to be able to read the newspaper or see their computer better at work, different specific tasks that they're having difficulty with. And then we sort of problem solve and find different tools and resources for them to be able to do those things. The last thing that I do is provide written documentation and point them towards resources. So the written documentation includes everything from statements of legal blindness so that they can get benefits that they're entitled to to school letters for recommendations for accommodations. So for my students, I will always write them a letter that has detailed instructions on how they can be best helped in the classroom for their vision. These recommendations are often taken to their IEP or 504 plan meeting, where they can sit down with their teachers and really make sure that they're getting all of the services and accommodations they need. As far as resources, there are all kinds of things to recommend. It really varies by state, but sometimes I'm providing, free audiobook resources, information about low vision and driving for patients who are a good candidate for that, work programs for anyone who has acquired vision loss and wants to go back to work and sort of learn how to adapt to their vision loss. So there's really just a lot out there, and it's a really fun, exciting world to be a part of. I'm really passionate about helping people with all levels of vision loss live their fullest, most independent lives. And I'm really excited to see where the next few years will take me and how this journey is going to progress. If you have any questions, feel free to contact me. I'm sure that my Instagram handle is going to be listed in the description, but it's easy to find me. It's at iDrJess, and I'm happy to answer any of your questions if you just send me a message.